So since the pandemic started, we actually have seen increases in depression and anxiety, and not surprisingly, post-traumatic stress in our youth population. It's really been in the general population, but specifically in our children and adolescents also. We've also seen emergency department visits increasing related to mental health concerns all the way down to our youngest kids. So we have rates of emergency department visits for mental health in our 5 to 11-year-olds increasing by about 30%. We know there are some demographic factors that actually increase risk, right? So actually the data has shown that girls during the pandemic have been suffering more in terms of their mental health. And that when young people have been in quarantine longer, isolated for longer, even out of school longer, they're actually predicted to have greater levels of anxiety and depression. In terms of have the resources actually then been increased to address that need, we have seen a larger investment from the federal government and from states in terms of workforce and in terms of just really trying to bolster the behavioral health system to respond to the need. But I think most would say that it really hasn't met the demand. We've seen a lot of positions posted from COVID relief funding, and they've been left unfilled because the workforce just isn't there. Although most students have some access to mental health providers in schools, we have a real workforce shortage issue in schools, including both our school employed professionals, like our school psychologists, school counselors, school social workers, but also in terms of having community mental health partners come in. So there was a national report card that came out just a couple of weeks ago looking at some of the factors that promote quality school mental health. It was put out by the Hopeful Futures campaign. And what they found was that in almost every one of the 50 states in DC, schools are severely understaffed in terms of those professionals. So there are recommended ratios of psychologists, social workers, counselors to students, and very few states actually meet those required ratios, causing wait lists for students, causing students to give up and not be seen, real issues with access to services. So that's one of the issues, is even with the injection of funding from the federal government and from states and even local communities, it's been very hard to meet the increased demand. So there's a lot that can be done to improve the quality of mental health services and supports offered in schools. And first and foremost, the supports should be offered in a multi-tiered layer or multi-tiered system of supports. And what I mean by that is that there should be kind of these universal supports that are put in place for all students to promote mental health and positive behaviors, things like restorative practices, like positive school climate practices. And then there are tier 2 and tier 3 supports, which are really intended for students who might be struggling or who may be at risk of developing a mental health concern. And school systems can put in place policies that promote effective multi-tiered systems of support. They can also put policies and practices in place to support mental health screening or well-being check-ins. And we're seeing a lot more of that in the context of COVID. In terms of who's responsible for that, one of the things that we would say is that the mental health of our young people shouldn't fall on the shoulders of any one child serving system alone. So it shouldn't fall just on the education sector or just on the behavioral health sector. And it certainly shouldn't fall just on the shoulders of families. They all need to be coming together, not only at the school building level, but really at the local and state government levels. So we can't just have your state Department of Education having to fund and support mental health of students, but it is part of their mission to support the whole child. At the same time, the behavioral health system at the state needs to be coming in and identifying how they can support the mental health of students where they are, right, in schools. So we can't wait for students to come to outpatient behavioral health care. The state behavioral health agency really does need to figure out how can they invest in school mental health services by doing things like leveraging Medicaid funds, fee-for-service reimbursement for on-site mental health services in schools. And one of the most important ways that we can advance mental health in schools is to hear from our young people and families. Their advocacy voice is really critical in making sure that mental health supports are available to every student in every school across the US. And that can look like, going and speaking with your local school administrators, but it can also mean speaking to your school boards, even to your state school board or your state superintendent, about really taking a look at what are the policies and where are the investments. And there's significant opportunity right now in the context of COVID relief funds and in the context of the current administration's investment in mental health. There's a lot of opportunity for families and for young people to advocate for better investment.